Sickle cell is a disease, it's an inherited disease, which is characterized by a defect in hemoglobin. So hemoglobin is very important to carry oxygen from the lungs to all parts of the body. So in children with sickle cell disease, they have a defect in this hemoglobin, and it causes them to have sickled red blood cells. So normal red blood cells are round and moves very smoothly in blood vessels. But in children with sickle cell, the red blood cells are sickle-shaped and are sticky. So they are prone to having what we call painful crisis and have got long-standing anemia. The University Teaching Hospital is the main referral hospital in the country, right? We've got the expertise in terms of doctors, nursing staff, and other supportive staff in able to manage these children with sickle cell disease. In the UTH records, we have over 6,000 patients with sickle cell disease, and the majority of these are children. On average, sickle cell accounts for close to half of patients admitted to Children's Hospital, and it's one of the top 5 causes of admission to the hospital, and so it is really quite a common condition that we see on a daily basis at UTH. Most children, I should say like close to 50 to 80% of children born with sickle cell disease in sub-Saharan Africa do not reach their 5th birthday. Okay, and this is because one, parents do not seek medical attention, so the children fall off the cracks and don't get adequate medical attention. Sickle cell disease is inherited. So for a child to have sickle cell, so it means that both parents carry the gene that causes sickle cell. And in any pregnancy, a couple has got a 25% chance of having a child with sickle cell disease. The earliest sign of sickle cell will begin probably around 4 to 6 months of life. So the first sign will be that the child will have what we call a foot and hand syndrome. So this is a painful crisis in which the child has got swelling of the hands and feet and experience pain. So you find that the child will be quite irritable. And then later on, as they are growing, they'll have what we call jaundice or yellowing of the eyes. And then of course they may have frequent infections, so they may be in and out of hospital, particular infections such as severe pneumonia. They may have infections in the bone, known as osteomyelitis, and they may also have severe anemia requiring blood transfusion. Another symptom that they may present with stroke, which can be quite debilitating. And they'll also have frequent episodes of pain requiring hospital admission and being given very good analgesics to help manage that pain. Basically, couples before they marry, it's important for them to screen for sickle cell, and testing for sickle cell is available in most hospitals in the country, so they know their sickle cell status. So basically, couples who find themselves that they've got the gene, they carry the gene, they have to make the tough decision on what to do regarding their future if both of them are carriers. The only cure for sickle cell disease right now is a hematopoietic stem cell transplant or bone marrow transplant. This is not readily available because of the complications and risks associated with this procedure. But the main cure for sickle cell is bone marrow transplant. Children with sickle cell can actually live a normal life, and they can live longer, they can go to school, they can play sports, they can go to college, they can go to university, they can go for work, they can start businesses, they can start a family and live healthy and productive lives. The important thing is for the parents to be able to, one, take the medications as prescribed by the doctor. Secondly, ensure that their children are fully immunized as per the Zambian guidelines for immunizations. Thirdly, they should eat nutritious foods. So basically all the foods types that they're eating in that particular home, the child should get those food types. So carbohydrates, proteins, fats, vitamins, and minerals are essential for children with sickle cell to grow healthy. Not only that, they should look out for complications that may occur, right? For example, if a child has got a pain crisis, they should rush to the nearest hospital for treatment. If the child has got a fever, a temperature more than 38 degrees Celsius, they should go to the hospital for treatment, or any other complication that may occur, they should seek early medical attention.